Namaste. It's that time of the year when our lungs face trouble breathing due to the cold weather and triggers various respiratory issues. Some issues may just need a steam inhalation and good rest and to recover. But some other conditions may require immediate medical attention. Do you know when to visit a doctor actually during these conditions? It's very vital to be aware of these ailments to stay healthy, and which is why we have with us Dr. Ilangho R P, Senior Consultant Pulmonologist at Apollo Hospital's main Greams Road, Chennai. He will help us understand various respiratory diseases and conditions in detail. Welcome to the FB Live session, Doctor.
Thank you very much for having me here.
Let's start by understanding the basic respiratory system, Doctor. What are the organs that are a part of the respiratory system, and how do each one of them contribute to a significantly better breathing for us?
The respiratory system is a system which has an organ called the lung. We have two lungs on two sides of the chest. This is the chest, and we have two lungs. Inside, in the middle, is the heart. In the gap between the two lungs is another space called mediastinum. I will tell you what it is. So the organ for breathing, which is the common man's language, is respiration, the medical term. So what happens in the lung here is that we breathe in oxygen from the atmosphere at 21%, and it goes into the two lungs. From the lung, it is pumped to about 100 trillion cells in the body. Now each cell in the body is a separate factory. And each factory in that cell is more than the New York City's electric grid. It's so powerful, each cell. So all these 100 trillion cells need to work like a factory, and they need electricity. Now this electricity is being provided by the oxygen that we breathe. It goes into the lung, from the lung to 100 trillion cells. In the 100 trillion cells, what happens at each cell, the oxygen goes in, and the cell works. For example, the cell in the brain works, in the liver works, and the heart works. But for every cell to work, you need the oxygen to go in like electricity. The oxygen goes in, and the food that we eat also goes into all the 100 trillion cells. And there is combustion like a carburetor in a car. And the pistons move, the cell moves only with the oxygen and the foodstuff. Once it is done like an exhaust pipe from a car, the fumes come out, and that is called as carbon dioxide. So we take in oxygen, goes to the 100 trillion cells. All the 100 trillion cells, like 100 trillion cars, throw out the carbon dioxide. They come out. So I take an oxygen, goes in, it's carbon dioxide. Now this is called as respiration. In other words, breathing. Which organ does it? The lung does it. Now I'm going to explain to you the importance of respiratory system, otherwise called as respiratory medicine. At the outset, this system has got certain differences from other systems. Now what are the five main systems in the body? The brain, the heart, the lung, the stomach, and the kidneys. So this is third in line. Okay, after the brain and the heart, this is the lungs. Now this system is called in various different names. For example, the brain is called only as neurology. The heart is called only as cardiology. The lungs are called in different names. I will acclimatize you to that. It is called as chest medicine, respiratory medicine, thoracic medicine. It is also called as pulmonology because the word pulmonale means the lungs. So we have different names for the same system. Remember that. And this system came into being down the line after other systems got graduated. For example, in India after the independence, 1947, modern medicine took off only after the 60s and 70s. So in the 70s, we had cardiology going up, cardiothoracic surgery going up, neurology going up, neurosurgery going up. In the 80s, we had interventional cardiology, the stenting going up. We had gastroenterology coming up with gastroscopies, colonoscopies. After that, only in the 90s, respiratory medicine started coming up. This was the history of respiratory medicine. And we here at Apollo Hospitals were one of the pioneering departments in the country to start respiratory medicine department fully fledged. Now, how is respiratory medicine different from general medicine is we do interventions called bronchoscopies. We put a tube into the nose, into the lung, like gastroscopy, which puts a tube into the mouth, into the stomach, like that. Interventional pulmonology created a difference, and we were the pioneering respiratory medicine unit in the country. And now at 2022, we have the greatest surgeons, the greatest lung transplant teams, which do all these things. So this is the importance of respiratory medicine. And what I would like to tell you is there is a lot to respiratory medicine which we do not know. People generally are very understanding about cardiology, about neurology, gastroenterology. But respiratory medicine and pulmonology, I'm here to explain to you the importance by saying to you the top 10 causes of deaths by the WHO or the World Health Organization. Amongst the top 5 causes, we have first is heart attacks, the second is strokes, third is COPD, fourth is lower respiratory tract infections. And if you take the next 5 to 10, again, worldwide it is lung cancer, in India it is TB. So out of the 10 causes of deaths in India, 3 causes, and the top 5, 2 causes of respiratory medicine. COPD, I'll explain to you, lower respiratory tract infections, and tuberculosis and lung cancer. This is the importance of respiratory medicine which the public should be aware of.
Doctor, coming to respiratory diseases, what are the symptoms that one should look out for in terms of respiratory
There are
diseases?
6 cardinal symptoms. Another thing is 6 main symptoms. There is cough, phlegm or sputum, and bleeding in the sputum called hemoptysis. So cough, phlegm, bleeding, breathlessness, chest pain, and wheezing. Wheezing means you hear a musical sound in the throat, especially children, like a cat mewing, or like a small musical note like a whistling sound. So cough, phlegm, hemoptysis of blood in sputum, breathlessness, chest pain, and wheezing. Along with this, you can or need not have fever, you can have loss of weight, loss of appetite. These are the main symptoms which, if persists more than a week, you should go and meet, apart from your general practitioner, a pulmonologist. And I'll give a small caveat in this, that people who have allergies, sneezing, running nose, and dust allergies frequently cough. Those people can maybe wait a little more extra. But people who don't have allergy and who have these symptoms more than about a week and is not being cured by your family physician or by your routine medicines that you take, then please go and consult a pulmonologist.
Now that we've covered the symptoms that could lead to the respiratory diseases, doctor, what are the most common respiratory diseases that we come across today?
Out of 100% of respiratory diseases, the 50% comes under obstructive airway diseases. See, the lung, I have not explained to you, consists of about 500 million, that is 500 million soap bubbles. It's made up of soap bubbles put together. Those are the 2 lungs, 250 million and 250 million soap bubbles put together. In this soap bubble, only the oxygen comes in and the carbon dioxide goes out. This soap bubble is provided oxygen by tubes called bronchi. Now, these tubes, if they get inflamed, it is called bronchitis. So the tubes are coming from here, the nose to the throat, into the lungs. These tubes are bronchi, and they end up with about 500 million alveoli or air sacs or soap bubbles, where the oxygen carbon dioxide change takes place. This air tube block is called obstructive airway disease. We have 2 most important obstructive airway disease you must know about. Most of you know about it. It's called asthma, or otherwise called as allergic bronchitis. As I told you, itis is inflammation, bronchi is breathing tubes. Inflammation of the breathing tubes due to allergy is asthma. Now the other one I told you, COPD, the third important cause of death in the world. Chronic obstructive pulmonary disease. Chronic means long-standing, obstructive means obstructing the tubes, pulmonary disease. So a long-standing obstruction of the pulmonary disease, apart from asthma, which is due to allergy, is because of pollution. The COPD is pollution. Asthma is genetically running in families. You can't do anything about it, the destined. But COPD happens only because of cigarette smoking. You stop smoking, you stop COPD. Also, another reason for COPD is air pollution from outside. You are living near a coal mine, steel factory, you're living near a nuclear plant, you're living near a power factory, you're living near an area where it is a Grand Trunk Road and there's dust, you're going to get COPD. And in India, it's now been taken up by the international guidelines only recently. In India, unfortunately, even people who don't smoke get COPD, especially the women, especially in rural India, which is about 60 to 70%. They cook not using gas, they cook using wood or some biomass fuel like cow dung. And these women from children, like from the age of 2 to 3, when they assist their mom at home, by the time they get 10 to 20, they land up with COPD. And the most dangerous fact about COPD is once it comes, you can't cure it. You can only manage it. Asthma can be reversed. Even cancer can be cut off in stage 1, 2, and 3A, and you can come back to normal life. COPD, if it hits you, you're done. So the most important part of COPD is that you stop smoking and you stop your air pollution from coming in. So the answer to the question of which are the commonest diseases is asthma and COPD. And in India, the national disease, tuberculosis, which affects the lungs.
We'll talk about asthma and COPD separately, doctor. What is asthma and what causes it, doctor?
Asthma is genetically made, and usually less than 12 years it comes and it goes away. But what happens In a layman's term, for you to know what is asthma is, as I told you, it's allergy. Allergy is what is normal for you is not normal for me. You don't sneeze when dust enters your nostril, but if it enters my nostril, I sneeze. Why? I have a certain body molecule inside my body called as immunoglobulin E, which is produced more than you. Therefore, genetic predisposition, allergy comes in. Now, what is asthma exactly? Sneezing, dust allergy, eosinophilia, these are all another term sort of given for asthma in India. And people say, I don't have asthma, I only have eosinophilia, I only have sneezing, running nose. What happens is when you get a cold, the nose tries to throw out a dust particle and it swells up and throws out fluid and liquid. You start a running nose. You see children having a running nose. So this running nose here, if it blocks your nose, which is your breathing tube, you sneeze out, you throw out the phlegm. But the breathing tubes inside are kilometers long, inside when they go in. These 500 million alveoli I told about. Those tubes, when they get blocked, you can't throw it out. So what happens is you get suffocation because the oxygen is not going in. Here, if you get a cold, it is called a common cold. The same cold, when it drops into your chest, it is called asthma. That's the best way to understand a cold happening in your chest. Unfortunately, there are no tubes coming out from the chest throughout the phlegm. It gets locked. Therefore, you need to use inhalers to open up the blockage, and that is what is called as asthma.
Is it hereditary, doctor?
It is 100% hereditary, and any patient who has asthma definitely will have a family history positivity somewhere. Grandfather, cousin brother, cousin sister, somewhere.
And what are the possible cure for asthma, doctor?
Asthma, the good news is it comes and it goes. Children, especially by the time they attain puberty, 90% of children will outgrow it. So that's very good news for parents. So when you see children suffering, it's very, very difficult. And another take-home message is that in children compared to adults, the asthma attacks have to be very highly managed. An adult can have an asthma and maybe the next day can see the doctor. But children suddenly, afternoon they have a wheeze, by 6 o'clock in the evening they can land up in the ICU on a ventilator. So children should be very careful in handling asthma, and they are hereditary.
Doctor, speaking about chronic obstructive pulmonary disease or COPD, could you tell us a bit about it?
Chronic obstructive pulmonary disease, the third largest killer disease in the world, is because of smoking or air pollution. Another name for that is chronic bronchitis or emphysema. So people who smoke after 10-20 years get this disease. Here what happens is, as in asthma, there is a cold in the chest. But the thing is, in asthma only the windpipes are affected. But in COPD, all the alveoli I told you about, the soap bubbles, which are so sensitive, they rupture. And once they rupture, you can't get it back in your life. You can't regrow your alveoli like your nail or your hair. So once the rupture of the alveoli takes place, oxygen, carbon dioxide can't go. So for both asthma and COPD, the main symptoms are breathlessness. Breathlessness, wheezing, cough, and phlegm. These are the common things between both. Asthma is because of allergy, and COPD is because of cigarette smoking and air pollution. Because of that, this happens, and the same problem happens. But the difference between asthma and COPD is asthma rarely kills, especially in modern days, and definitely not in adults. But COPD is a killer disease. You leave it down the line. Some of our great movie stars have had asthma and have suffered a lot. And you have to be with oxygen. You're like a respiratory cripple. As you have a person with arthritis not able to walk, you become a cripple not able to walk because you can't breathe. And once the destruction of the alveoli happens in the lung, it produces other problems and you land up with respiratory and lung failure.
So what are the treatment options for COPD, doctor?
The treatment options for both COPD and asthma, I would say, is inhalers. So we have here what is called as inhaler. The days of tablets are gone. This is an inhaler. We have the tablet in a smoke form, directly goes into the lung. One of the greatest revolutions in medicine, like an eye drop, a ear drop, an internal organ getting an immediate effect. This is the only organ. You can't put this into your heart. You can't give heart medicines to the heart or liver medicines to the liver immediately. But this can do this. This is a revolution. So ask for your doctor for inhalers. The second mistake is inhalers not being used. If they are used without spacer devices. So you attach like this, put it in your mouth, press once and breathe 5 times. This is called as a spacer device. This is the most important message in my talk today. One is the importance of respiratory medicine. Second, using of inhalers, spacer devices. This is what you use. And once you use, you know about blood pressure apparatus for BP patients. You know glucometer for diabetic patients. Like that, to monitor blood pressure and diabetes, to monitor COPD and asthma especially, you need to use a peak flow meter. You see there is a scale here. Just put it in your mouth you blow, the scale moves, and you know it is 200, 300, you make a diary of this. So peak flow meter. This is the next thing to do. And what are the medicines? I told you, the inhalers with the spacer device, then the capsules not to be taken inside. If you're able to see this, this is another device. You put it in, inside this, you turn it around, very simple device. You press this, the capsule gets punctured, you put it in your mouth, inhale, the powder goes in. Very handy, not even big as the inhaler or the spacer device, just put it in your pocket and go about it. Greatest medicine in the revolution of things. Another one is for people who have severe COPD, young children, and people with severe asthma. We have another great invention. This is called as a nebulizer. The same medicine comes through us like a smoke, and you attach a mask here and you can inhale it. So this is another great revolution called as a nebulizer. And at this point in time, I would like to caution the public and tell, even doctors are practicing sometimes, they are giving intravenous dariphyllin injections. Not to be done. That's gone 30, 40 years ago. No more intravenous injections at the emergency because of wheezing. You want to go for an emergency, ask for a nebulizer, not for an intravenous dariphyllin injection. Intravenous dariphyllin Decaron, those days are gone.
So how do we understand whether it's COPD or an asthma attack, doctor?
Excellent question. Very simple. You have a family history of asthma or allergy, tick. You need not go to a doctor. And you have a self-history, personal history of allergy, which is sneezing, running nose, colds, eosinophilia, headaches, sinusitis, allergic conjunctivitis, allergic diarrhea. These two are ticks 100%. No more tests. You are asthmatic when you have a breathing problem. But COPD, you need to have smoking. And when I teach my students and ask them what are the top 10 reasons for COPD, number 1 is smoking, 2 smoking, 3, 10 is also smoking. So the most important cause of COPD is internal pollution by smoking by the human being, and external pollution because of gases outside, like a chlorine factory, coal workers, mines, and different steel factories, especially in Bengal. A lot of factories, iron ore factories, they produce these problems. And that produces a disease also called as pneumoconiosis. That is the reason.
Is passive smoking also one of the causes of respiratory diseases?
Very dangerous. Passive smoking, tobacco smoking is very dangerous. The husband at home smokes 10 cigarettes a day. The wife who's along next probably smokes more than the husband, because husband is smoking and leaving. That extra thing is going out into the atmosphere. So we call it as environmental tobacco smoking. That has to be strongly stopped. If the family member is not willing to stop, the family member has to go outside and smoke.
You mentioned about external factors like people working in steel factories, mine factories, and other occupational hazards. Occupational and environmental lung diseases. Could you explain about it?
OELD is a disease which is very rarely spoken of even amongst medical circles, and when a medical student takes an examination, they miss it out. It's called occupational and environmental lung disease. There are 5 top causes. One of the most dangerous is lung cancer. Second is COPD. Then occupational asthma. You're working in a research organization with a lot of organic chemicals. With a family history of asthma, you may get asthma. Pneumoconiosis due to dusts. Like you are in a grain factory or in a poultry farm, you may get it. You are working in a coal mine, you're working in a steel factory, working in an iron ore industry, you will get it. So these are the things. The 5th one is hypersensitive pneumonitis. You grow pigeons and you get what is called as a bird fancier's lung or pigeon lung, or you get farmer's lung. These are occupational environmental lung disease. So you're working in a dangerous environment. You're not working, but you're living in a nice house, but in an area surrounded by factories. Again, you are in a problem. So be careful. Occupation and environment are very important. Or your workplace is good and your living place is good, but the transit zone, you're going to spend 1 hour on a bike going across an iron ore factory, done. Change it, because it's worth it down the line. Or you'll end up with COPD and spend your entire life spending on healthcare. You will not get back your health. You'll end up with a lung transplant.
Doctor, let's speak a little bit about lung cancer. Is smoking the only cause of lung cancer, doctor?
20 times more chances if you're a smoker. That's the statistic. So that explains everything. So you stop smoking, you reduce your chances of getting lung cancer. But then the question is, doctor, I have smoked. If I stop now, then it regresses. You smoke for 5 years, it will take another 5 years for you to get back to ground zero. But the good news is, yes, if you stop smoking, the chances of reduction of this 20 times is less. And smoking is the most important cause. Remember, one puff contains how many chemicals? 1, 10, 100. It contains about 10,000 chemicals, one puff, and a lot of it are carcinogens. It's like poison through a gas form.
And what are the diagnostic methods and treatment options available today for lung cancer, doctor?
Not only for lung cancer, generally for respiratory medicine itself, the investigations are very simple. You have something like this, a pulmonary function testing apparatus attached to a computer. You go and blow into it, you get what is called as pulmonary function testing report. It's like an ECG you have for heart diseases. You have a line like that. You will get a line on the pulmonary function testing when the lungs are connected to a computer. So that is called as pulmonary function testing. If I get a pulmonary function testing report of a person and an X-ray chest, that's enough for me to make a diagnosis. We may require CT scans down the line to find out further things. But the most important thing is pulmonary function testing and CT scans. And for lung cancer, we have what is called as a PET scan. Even without a biopsy, 99% we can be sure looking at the PET scan, that's a whole body PET scan, giving a dye, whether it's lung cancer or not. And then we have blood tests and other tests to back up. But the main thing is pulmonary function testing and X-rays and CT scans.
So, doctor, what are the various other conditions that we people as laymen should be aware of?
Yeah. See, the other things apart from tuberculosis and occupational environmental lung diseases, that we have what is called as fluid collection in the lung, which is pleural effusion, which is fluid collection in the lung, mostly because of tuberculosis and lung cancer. We have other things called as interstitial lung disease, which is coming very much, and people don't know what is the reason. The entire lung gets shrunk, and that is called as interstitial lung disease. Another thing, pulmonary thromboembolism. Another take-home message, third take-home message. If I ask you the question, which is the commonest cause of death in an ICU, you will say heart attack. No, it's pulmonary thromboembolism. What is pulmonary thromboembolism? A blood clot in the lung comes to the lung and explodes like a bomb. Patient dies most of the time. That is called as pulmonary thromboembolism. Another thing, vasculitis, inflammation of the blood vessels in the lung. This can produce a condition called as vasculitis. Another thing is like asthma, we have what is called as SPI syndrome, or pulmonary infiltration with eosinophilia. When the eosinophilia is high, you can land up also with malignancy and cancer. The other one is connective tissue diseases, especially women. You have rheumatoid arthritis, different arthritis. People who have arthritis, especially systemic lupus erythematosus, can land up with lung involvement of connective tissue diseases. So you have arthritis, meet a respiratory patient if you have any of the respiratory 6 symptoms I have told about. Then mesothelioma. You have cancer of the pleura covering the lung, and that is because of asbestos exposure. Like this, we have another thing called as sleep disorders or sleep apnea. The test for that is polysomnography. We attach EEG and certain electrodes here. Through the night we check, and then we go in for what is called as a polysomnography. We get a recording, we look at it, and we give you a machine like a nebulizer. It is attached to your face and nose, and in the night it gives you a respiration. So these are the conditions where we have different types of diseases which you are not aware of, and we have ultimately what is called as a lung transplant. Lung transplant, where both lungs or a single lung are transplanted because the lung has gone in for lung failure, where the oxygen is not going in and carbon dioxide is getting retained. So this lung failure happens in patients who have COPD, who have lung cancer, who have long-standing diseases like tuberculosis, which goes on for years to years, and the lung gets destroyed and the lung has to be replaced. And we have one of the pioneering lung transplant teams having done the maximum number of lung transplants in the country.
So what are the preventive measures that can help us keep these respiratory diseases at bay, doctor? And what's your message to our viewers today?
See, the human being is not made up of single systems. That's the only thing you have to understand. Take home message again, number 4 is you are a whole. There is nothing called as respiratory system, cardiac system, neurology, gastroenterology. Like you take a satellite view of the earth. There is no India, Pakistan, USSR. That's what the lines you have put. So these gradings are only human made. Learn to live a routine, normal life, giving time to yourself, to your body and mind. The advice is 30 minutes of exercise separately away from your routine work. You walk, or you swim, or do cycling, 30 minutes. Another 30 minutes, you do some exercise for your psychology. You meditate, you do yoga, asanas, etc. So, which means 1 hour a day you spend to yourself, not to your government, not to your nation, not to your family, not to your corporate. To yourself, 30 minutes for your body, 30 minutes for your mind. If you do this together, you will never come to see a doctor ever.
Thank you very much, Doctor. That was a very insightful session on all we needed to know to stay healthy. For appointments with Dr. Ilangho R P, Senior Consultant Pulmonologist at Apollo Hospitals Main, Greams Road, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, Doctor. Thank you, viewers.
Thank you very much. Best wishes for a good health.